Hi you guys, we're starting off a little bit early. I just wanted to take the time to introduce myself to any new listeners in who don't know me. So I'm Dr. Alex Calderone over here at Peak Family Chiropractic. I started here about 6 weeks ago. Practiced in Florida for about 2.5 years and decided I wanted to run away from those hurricanes and came onto the north over here in Ohio and loving it so far, not scared from the cold, so that's good. What we're going to be talking about today is subluxations and their relation to issues of miscarriages and infertility. So to start off this whole topic, I want to discuss first what a subluxation is, because it's this big crazy word that a lot of people just don't understand. So this poster does it great, absolutely wonderful. So as chiropractors we use that term subluxation, but what we're really talking about is joint misalignment. So how we end up developing that joint misalignment is through things like traumas or bad habits. And it can even be micro traumas, which means little things that just occur throughout time, whether it be continually lifting something wrong or playing a certain sport. So what happens are those joints end up getting stuck in a certain place, which restricts our range of motion. Our body's not stupid, our body's super smart, so it wants to protect that area. So what it does to protect something that's not right is it tightens the muscles around it. It creates inflammation to further protect it. But the caveat to that is that it eventually, because of all that pressure from the inflammation, from the tight muscles, and the misalignment within that joint, we actually get pressure on those nerves. The problem with that is that not only are we not getting motion in that joint, but that nerve over time is continually being beared down on with compression. And the reason why that matters is because when people think of chiropractic, they often just think it's the spine, right? We just gotta, it's painful, so we need to keep it moving. But that's not the end of it. It's also about making sure that we have a healthy nervous system. So those nerves that come out and down our spine and come out and innervate into our organs and our muscles and our tissue, all of it. But it's important to understand that what's going on in the spine can actually correlate to improper function of our organs as well. So something else I want to touch on too is that our body, again, it's very smart. So it's not just one organ on its own when we're talking about organs, it's systems. They work together, almost like a relay system. So one of the organs in particular that we'll be talking about today, and a subluxation that affects it, is the pituitary gland. So we have to understand that it's not just the pituitary gland of its own. The pituitary gland also works with the hypothalamus in this relay system, almost like a feedback loop. If the pituitary is not sending a proper signal, the hypothalamus is going to respond to that by sending out a hormone or not sending out a hormone. So it's not just about one organ, but it's about how it affects a multitude of organs. So let's go ahead and dive into that, since the pituitary is going to be one of the main things we discuss. So our pituitary gland, for us females, it's responsible for our reproductive cycles. It helps us to release those hormones that we need to be able to go from each day all the way to the end of our cycle. So gonadotropin releasing hormone, like the hypothalamus that we talked about, is released from the hypothalamus to the pituitary to tell that pituitary, hey, it's time to release some hormones. So what that pituitary does in response is it releases two hormones in particular, and that's going to be the follicle stimulating hormone and the luteinizing hormone. And those hormones also go into producing our estrogen and progesterones. And these are all necessary for us to have a healthy cycle. So again, this just discusses that we do have that relationship between two different organs in that feedback loop. And the reason why I'm pressing on this is because it's important to understand that if something is going wrong, if something's off in the spine and it happens to be an area that correlates to that pituitary, well, that pituitary is not getting the proper nerve function or blood flow if we're having a twist in a location. So that means that pituitary might be showing signals to the hypothalamus saying, hey, I already have enough of this, or I don't have enough of this. So then it's almost like it's getting a misrelay of information or not enough information to where we start having disorganization within those organ systems. So again, just touching on what exactly FSH and LH is, and this is a little in-depth, I know it is, but I want to make sure you guys understand what's going on, because it's important to understand what's going on with our bodies. So FSH occurs right there towards the beginning of our cycle, and it produces the estrogen. So whenever we get towards our ovulatory phase, we start to create these follicles that come off of our ovary. Those follicles have the eggs. So what the FSH does is allows that to start to be created so that LH, which is luteinizing hormone, will surge up and allow for that follicle to rupture and release so that our fallopian tubes can pick it up and carry it so that it can be ready for fertilization. So obviously the pituitary plays a pretty big role, so we want to make sure it's doing what it's supposed to do, especially when it comes to infertility or miscarriages. Cranial subluxation, that's the first thing we are going to talk about. So when we're talking about cranial subluxation, we're talking about the base of our head specifically. So we call that our occiput. A lot of people just feel it right there at the base of your skull. And what this does is it can actually be stuck side to side, back or forward, putting pressure near our brainstem. And those nerves in particular that come out of that region integrate into the pituitary gland and influence its function. So we see here cranial subluxations lead down to influencing the pituitary gland, which secretes FSH and LH, like we talked about. FSH, if we are not creating those follicles from our ovary, well, then we can't continue to the next step. So if we're not creating those follicles so that they can come out of the tissue so that they can be fertilized, well, then we're not going to end up having a fertilized egg. LH results to ovarian function, meaning that surge of LH that causes that ovary follicle to come off so that it can again travel down into the fallopian tube and get the fertilization that it needs. So a lot of times this can relate to first trimester miscarriages, because what's happening again is that we're either not getting that separation from the ovary, or LH is also responsible for a surge of hormones that allows us to build our endometrial lining. So if we don't have a proper endometrial lining for that egg to implant into, our body is going to reject it because it's not a safe environment for the egg to be able to thrive and grow. So then we end up having a miscarriage. So this again is another picture, and Jackie, tell me if you can't hear me. This is another picture just talking about how this bone in particular, if it's twisted to the side, it's going to start causing issues and compression within the nerve and within the blood flow. And that's important too, you know. Think about our organs. Do you think our organs would function very well if they didn't have good blood flow? Of course not. Of course not. Blood flow is great for many things. It's good for function, as well as it brings oxygen to the tissue, which oxygen is necessary for function too within our organs. So the next thing that also affects the pituitary gland is going to be the top bone of our neck, which is called our atlas. So this is directly going to influence the blood supply, like we just talked about, making sure that the pituitary has adequate blood supply so that it can perform its functions. So if we're not having proper blood flow, that means that organ's not properly doing what it's supposed to do. And that means that it's not going to be sending out the correct hormones it's supposed to, the correct amount, maybe not enough, maybe too much. It just depends on what's going on and how the bones are stuck in that particular area. Sympathetic nervous system function is huge. A lot of people don't realize, again, that when we're adjusting the spine, it's not about the pain, it's not about the pop, it's not about just about the joint, but it's also about the nervous system in general. So our nervous system is broken down into two parts. We have our parasympathetic nervous system and we have our sympathetic nervous system. Think about that as putting on the brakes or stepping on the gas. So parasympathetic nervous system is basically our rest and digest. Let's putting on the brakes. Let's slow it down. Let's make the body calm down. Sympathetic is our fight or flight. If a bear was chasing me right now, my sympathetics would be lit. I would be running, going, ready to go. So that's the gas pedal. What happens when this cervical vertebra is twisted and putting pressure onto a nerve, it's not only putting pressure onto a nerve, but it's putting pressure onto the brain stem. So what it can do is actually kick us up or bring us down, depending on how it's pushed. So it often can relate to things like depression and anxiety, breathing issues. A lot of things can be correlated with that top cervical bone because it's so close to our brain stem that any compression is going to influence a little bit of everything. So if we're talking about the sympathetic nervous system and we're talking about how it could influence infertility or miscarriages, that's because our body is stuck in this stressful state because sympathetic is the gas pedal, right? So we're stressed. We're going to be creating more stress hormones, which are going to relay back to the hypothalamus, back to the pituitary, and say, hey, I need more of this, less of this, and it's going to set our whole system off. Stress greatly influences us, but when something's stuck and the nerves aren't signaling correctly, it's going to bring that anxiety through the roof, in particular to that top atlas cervical bone. So this is just an example. Again, that vertebral artery gets pinched if we're twisted off to the side, and the brainstem compressed if we're twisted off to the side. That vertebral artery is key because that's one of the main arteries that innervates into our brain and supplies our brain with the blood flow it needs. And that includes the hypothalamus, and that includes the pituitary. It's the start of it to get all of the blood flowing within the brain and branches out to many other vessels and arteries. So again, I just wanted to touch because that top bone is so very important. It can cause a lot of issues. So different things it can affect is that it can affect our brainstem, pituitary gland, inner ear, middle ear, optic nerves, how we're seeing things, how we're moving our face, our sinuses, swallowing. It can cause symptoms like headaches, migraines, ADD, ADHD, different disorders, insomnia, high blood pressure is huge for that one, reflux, memory, the list goes on and on and on as to what it can cause. So it's a key element when we're talking about different functions within our brain. It has to be in the right place. So this goes into and breaks into between our parasympathetic and our sympathetic nervous system and different areas of the spine that innervate or are more sympathetic versus parasympathetic. So again, when we are talking about our cycle, we have to understand that those organs do directly correlate. They have to work correctly. They have to have the right neurological input and the correct blood flow to be able to do what they're supposed to do because it controls our hormones. And if our hormones aren't working correctly, then neither is our cycle, whether that's regular menstruation or whether that's trying to have a baby. Another subluxation I want to discuss with you guys is actually the bottom bone of our mid-back. And that guy is going to be right here, okay? So as we can see right here, and then this is the start of our low back. We can see how these nerves are coming out. If it is pinched and twisted, it's going to compress into that nerve and start causing some issues, as well as arteries. This one in particular doesn't have all the arteries on there, but it would compress into our arteries for that particular region as well. So 12th thoracic vertebra is very specific to the fallopian tube. So our fallopian tube, let me show you this really quick. So if we're looking at a picture of our pelvis, can you see that, Jackie?
Yeah.
We have our uterus here, and then coming off of our uterus are our fallopian tubes, and then sitting right there are our ovaries, okay? That way we have an idea as to what we're looking at. So fallopian tube is, think of it like this muscle of propulsion. So same thing as our intestines, right? When we are moving food down our bowels, there's this motion that occurs. We call that motion of that moving it down into our intestines called peristalsis. So fallopian tubes have this type of function too. So we need to make sure that those muscles are working correctly. It's not just about these muscles, it's about the muscles within our organs as well. They need to be doing what they're supposed to. And that includes having the correct neurological input from our nerves that come from our spinal cord and brain. So it's important that we're not having any compression in those regions so that our fallopian tubes are acting as they should. The other thing that it can relate to are ectopic pregnancies. So let's say, you got a fertilized egg. So that egg separated from the ovary, came to the ampulla, which is a portion of a fallopian tube, and fertilized. Well, now what? If that fallopian tube is not working the way it's supposed to via blood flow or nerve input, it's not getting that strong nerve input for peristalsis to move. Well, that egg can get stuck and actually stay in that fallopian tube, and we call that an ectopic pregnancy. Now keep in mind there are many reasons that these types of situations can occur, but subluxations are something that can be a related factor as well. Not only does that bone affect us females, but it also affects the males. So it will directly correlate into testicular function. So whether the men are actually able to release their sperm, or even being able to have a erection or ejaculation, can directly relate to improper nerve function coming from that T12 vertebra if it is stuck in place or subluxated. For females, we already talked about fallopian tube, but it also affects our ovaries and our uterus. And why this is important is because our uterus is also muscle. So what happens whenever we get to a certain phase in our cycle, particularly towards our period, is that we get contractions within our uterus to help shed that endometrial lining. If we're not shedding that endometrial lining fully the way it should, then we can start to get even horrible, painful periods and things like that, or just not have that fresh layer for a new baby to implant into. So ovarian function, if it also correlates into the release of that egg from the ovary. So we got two things affecting that. That's going to be cranial subluxations, C1 or atlas, and our 12th vertebra. It's also key in maintaining a pregnancy, because if this is influencing our ovary still has responsibilities as we're pregnant. We still have to release certain hormones so that we can maintain that pregnancy and keep growing a healthy baby. So making sure that we have, again, adequate blood supply and adequate nerve function to that organ is crucial, absolutely crucial. You want everything working at its best. The next thing I want to talk about are subluxations within our pelvis, specific to our sacrum, which is our tailbone, and our coccyx, which is that very bottom piece of our tailbone. So if we go back to this little image over here, we can see how close our sacrum sits to everything. Not only that, but even our whole pelvis through here. I don't know if I'm in the way or not.
No, you're fine.
But the big thing to understand is that what our pelvis is doing, what our sacrum is doing, if it is compressing nerves as well as compressing our pelvic outlet, because that's another huge thing with issues, are the shape of our pelvis. Well, then we're definitely going to have issues in terms of carrying a baby to term, or even getting pregnant in general. Here. So cervix is huge too. So the nerves that come from our sacrum or our tailbone innervate into the function of the cervix, and what can happen is either mainly the cervix doesn't close all the way, and that's when we start getting those second trimester miscarriages. If our cervix isn't staying closed, well, then we lose the integrity of being able to hold that baby where it's supposed to be. As we go through menstrual reflux, that's the tough one to talk about and still a little misunderstood in our world today. So menstrual reflux is actually when instead of completely evacuating our endometrial tissue in the lining of our uterus, it actually backflows up into the fallopian tubes and can be within our peritoneal cavity, which is basically in our abdomen. What can occur with that is because that tissue has spread somewhere where it's not supposed to, these abnormal cells, is that our body can recognize that, hey, why are we having this tissue here? And then think that that's an adequate place for implantation of an egg to go. So that's when we get things like endometriosis, where we get that endometrial lining in weird areas of our body that it's not supposed to be. It's supposed to be in our uterus. It's not supposed to be in our bladder, kidney, or in our abdominal cavity anywhere. So again, those types of issues, if we're having issues with our cervix and we're having that backflow, or we're having issues with endometriosis, and we're not even going up back to the 12th vertebrae and back to C1, if we're not having adequate muscle contraction of that uterus and we're not completely evacuating the lining of our uterus out every month, then we're going to start to have issues with infertility as well. So the main thing I want you to take away from this is that chiropractic care affects organ systems as well. And it's going to influence us when we as females or males are trying to work on having a baby. So something else I want to talk about is, again, second trimester miscarriage often is caused by problems with the uterus or a weakened cervix that dilates prematurely. Muscle function, huge, and those nerves play a role into that. If it is not being correctly innervated by our neurological system due to something being out of place, something being compressed. If you remember in the beginning, we said that a subluxation is when a joint is misaligned. Our body responds by tightening the muscles, putting inflammation in that area to continue to protect it because something's not right. And then over time, that compression starts to come in around that nerve, compress it down, and reduce function. And that's where we start to get these disorders within our organs. I believe that's the end. Obviously, there are a lot of other things that correlate into these issues. And if you guys would like to hear about them, I would love to talk to you about them for sure. It's a sad thing when we have issues with infertility and miscarriages because, you want to create a family, and that's really important to you. And it's important to try everything and learn all that you can if you're having a particularly difficult time with it. But understanding your body and the issues that you have is key. But again, if you guys are interested in other things, whether it be nutritional or more in depth on hormones, I'd love to talk to you guys about it. Please feel free to put a comment down below and let me know if y'all are interested in going more into depth on this. We plan on going through a few more discussions on pregnancy and adjustments with pregnancy, and then we can even go into nutritional deficiencies related with infertility and miscarriages as well. I really hope this was helpful for you guys, and I hope that you got something out of this. If you're having issues with infertility, with miscarriages, or just want to be checked out, maybe you don't know yet, or maybe you want to just make sure you're healthy so that you can be ready to be a mom and you can carry a baby and your hormones are working great and everything's just wonderful. Maybe you just want to be checked out. If you would like to, I would love to see you. I'd love to talk to you, and I'd love to have you in for a consult. So if you are interested, please give us a call. I'd love to talk to you, and I'd love to help you out. It was great seeing you guys.